Today's topic is a topic that is near and dear to my heart for so many reasons. And the topic is that our healthcare system is actually designed to keep us sick. Now, this topic is going to upset you. This episode is going to upset you. And I know because it upsets me every single time. I do want to say this. This is absolutely not a political episode. It doesn't matter if you're red or blue or purple or anything in between. This is just the facts of the state of what's going on with our healthcare. Everyone who comes to the new method comes here because at some point the healthcare system failed them. And there are a million reasons as to why the system is failing. In fact, I teach this topic for an entire semester every spring here at Wagner College. So making it a 20-minute video means I'm probably not going to cover all the topics. No, I'm definitely not covering all the topics. So in your comments, you might say to me, hey, why didn't you talk about this? Why didn't you talk about that? Yes, just yes to everything. There's so many reasons. I just chose 3 or 4 to focus on to really give you a glimpse of why this is happening, why so many of you come to the new method just crestfallen and disappointed from the healthcare system. And of course, this is gloomy, but if you know me, you know that I'm a forever optimist. And so, of course, I'm going to give you a personal solution how to make the system work for you, even though it's designed to keep you sick. Before I start, let me just tell you how to reach us. If you're watching us on Facebook, drop the word live. Let us know that you're here because it makes our day. And why not do that? It's an act of kindness. If you're watching us on replay, type the word replay. Let us know you're watching later. Type the word change anywhere on any platform and it'll let us know that you want the show notes. And of course, if you're watching us on YouTube, don't forget to like and subscribe. Again, an act of kindness. It costs you nothing. It makes us happy. Let's just do it. And if you're listening to me on the podcast, of course, my background is the same. My hair looks amazing. I'm wearing a white sweater and always the stethoscope that my wife bought me. Hi, Gigi. And wherever you are, follow us on Instagram because we're super funny on Instagram. That's really where the entertainment is at. And share this with the people that you love so they can become the game changers in their life. And if you don't know who I am and you're still listening, allow me to introduce myself. My name is Efrat Lamondre and everyone calls me E. And I invented the new method where we empower people to realize that their symptoms are not in their head because you always knew there was a better way. So, wherever you are, join the conversation. Let us know that you're here and let's dive in to healthcare. And so, I'm calling it healthcare. It's called healthcare, but is it really? So, first, let's get some facts going. America spends at least twice as much on healthcare than any other country in the world. And I say at least twice as much because in most countries we spend more than twice as much, but at least twice as much than any other country in the world. And so you might say, that's okay. You get what you pay for. We spend the most, we get the most. So who cares? And by this logic, we should have the best healthcare in the world and we should have the best outcomes in the world. But we don't. Out of 36 developed countries, we have the highest infant mortality rate. We come in, we should be at the lowest. We're not, we're coming at the highest. We come in 33 out of 36. We should have the lowest obesity rate. We're 36 out of 36, dead last. At the very least, we should be living longer with all this money that we're spending. And we don't. We come in at number 28 for lifespan out of 36. In fact, this is the third year in a row that in the US, our life expectancy is getting shorter than the year before. So the question is, why is the most expensive healthcare system not working? How is it that our nation is getting sicker and sicker? And our healthcare system is just not designed to help us out of it. Now, again, I just want to say this is a really long topic. It usually takes me a semester. So I only took a few topics to give you a glimpse of this mess. But let's start. The very first issue, as I'm sure you know, is insurance. And don't forget, this is going to be a little technical, but at the end, I'm always going to let you know how we can use the system to our advantage. So, insurance. Now, for those of you lucky enough to have insurance, let's not even talk about the people who don't have any because that's a whole other semester. This is how it works. And this is really important that you understand how this works. And for those of you who do, just bear with me. You go see your medical provider. He or she treats you. She creates a chart. In that chart of the notes, there's a series of codes. Some codes are called ICD-10 codes, which is the name of your disease or your issue, like ear pain, gallstones. It has a code. And the other code is called CPT code, which is a code for the work that was done. So, for example, if you went and your ear hurts and you had earwax removed, there's one code for ear pain and one code for wax removal. Or if you just went to your primary care, there'll be a code for, was this a simple visit, a medium visit, or a complex visit? And again, if you have a procedure, then there'll also be a procedural term. If they removed something, there's a code for that. So the medical provider sees you, they write a chart, they put a series of codes in there. You go home, this chart and the bill is sent to the insurance company, and the company pays for it, maybe. Now, the prices for these codes, by the way, are not dictated by the provider. Your doctor, your NP, your PA, we have no control over the price. Your medical provider can say, I want $1,000 for a visit, and the insurance company is going to say, great, here's $25. This is really important to know because a lot of people get mad at the providers, but the providers are not in charge of pricing whatsoever. They simply create a list of codes, and then those codes are sent to the insurance company, and they pray that they get paid something. Okay, so what's the problem, E? What's the issue? Let me break it down for you, okay? So the problem is that with all of this, remember, you came in, you got codes paid for it. The problem is that it doesn't matter what the outcome is. The insurance pays for the procedure or the visit, whether or not it was successful. It's not outcome based. Now, in order to understand, what does that mean? It doesn't matter. It doesn't matter. It doesn't matter if the wax out of your ear helped you or it didn't help you. It doesn't matter. It's not outcome based. But before we start getting angry, let's figure out why we're in this situation to begin with. So allow me to create an imaginary world where, I'm going to talk about this world. It's called Toaster World. And I'm going to talk to you about toasters because for some reason I decided when I made this metaphor about toasters that it'll be easier to understand. So imagine a world where people have to go a really, really long time to learn how to make toasters. And when they're done with school, customers who want toasters come to them and they spend a lot of time with their customers and they make the perfect toaster that the customer likes just the way they like it every time. They take as much time as possible and they go back and forth until the toaster is just right. Customer is happy. They walk away with a great toaster. You have to get regular maintenance or repairs and everything is great. And let's also imagine that in this world, toasters are really important to stay alive. But some people can't afford the toasters, or they need a very specific kind of toaster that, maybe is a little bit more expensive. So this is a problem because they can't afford toasters. So these guys come in and said, all right, we have an idea. Instead of you guys paying for your toasters every time, since you don't need a toaster every day, what we'll do is we're going to collect a little bit of money from each and every one of you every month, just a little bit, enough that you can afford, so that when the day comes and you need a toaster, you'll go to the toast maker, but you're not going to pay the toast maker. We're going to pay for that out of the monthly dues. This is what's called a third-party payer. This is how your insurance works. Sounds like a great plan. I'll give you a few dollars a month, and then when I need a toaster, I'll go to the toast maker and get what I need. But they said, in order for this to work, the customer and the toast maker can no longer have transaction. They cannot exchange cash. You have to go through the third-party payer at all times. Okay, so at first this worked, but then some people need a few more repairs on their toasters. And some toaster makers really like to take time making their toast machines to perfection. And the middleman said, no, 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 no. For this to work, you cannot customize each toaster to each person. You have to make the same exact toaster every single time. Doesn't matter. The single man who only makes one piece of toast a month has the same exact needs as the mom of 6 who needs to toast everything in time for the bus to pick them up. Doesn't matter. Toast makers, for this to work, for us to keep paying your bills, you have to produce the same exact toaster every time. And the toast makers are like, wait a minute. I spent years and years learning how to make these machines. Don't tell me how to make them. And the customer said, hey, not all machines are alike, and we need for it to be customized. And the CEO of Toast Fund said, I'm not listening to any of you because what I'm concerned about is my profit. I am running a Toast Fund business, And as a CEO of Toast Paying Fund, I just bought myself a brand new house. And the only way I can pay the mortgage is to make sure that these toasting transactions are quick and cheap. Now, obviously, no one like this. The Toastmakers are like, we take pride in our work. We went to school for this. We don't like this. The customers are not happy with the toasters that are being produced. But the third party payer said, that's your problem. It doesn't matter to us if your Toastmakers are good or not good, just produce them. And the CEO of the fund is fine working with it just the way it is. So no one's happy. And and what are we supposed to do? So now the third party payer says, oh, by the way, I also decided that I'm going to pay you less for these toasters. And I decided that the customers have to pay more, something called a copay, to get these toasters out. Okay, so basically, I think you're getting this, right? The point is the system may have started to help people initially, somewhere in the 30s, maybe, questionable. But what it is now, it's a system that's designed to force Toastmakers to make lots and lots of machines. Doesn't matter if they work or don't work. It forces the customers to take whatever machine is given to them. Sometimes it fits, sometimes it doesn't. Neither side is happy, and there is no conversation whatsoever anymore about the quality of the machine, and that's because the CEO of Toast Fund only cares about the bottom line. So I ask you, in this crazy world that I created, this toaster world, how can you possibly get a customized toasting machine in a system like this? You can't. So the system, the way we have it now, is built with volume in mind, not the quality of the product. The medical provider puts in a code, they get paid for their toaster, aka their service, and it doesn't matter if there's different levels of quality. And it's not the provider's fault. This was a system that's designed without the provider or the patient in mind. It's not about quality. Think about it. Any other industry, it's about quality. If you like a restaurant, you go back. Enough people don't like it, the restaurant closes. Not in healthcare. The quality doesn't matter to the people who run the system because you have nowhere else to go. Just know this. The medical providers care. Of course they care. They went to school. They care. The patients care. It's their health. But the people who run the system don't. And in this healthcare system, to use this toaster analogy, there's no incentive whatsoever to produce great customized toasters. Your medical providers are not evil people. They're the victims of the system as well. They dedicated a big chunk of their lives to go to school, and they're doing the best they can, but they don't get paid at all to spend time with their patients, customize care, or get to the root. They get paid to just keep selling toasters and are told by the fund what toasters to make for each customers. And this is happening to medical providers everywhere. The insurance company keeps cutting what they're willing to pay, but the provider's expenses don't go down, right? They still have office staff, they still have electric bills, they still have, so the insurance company, what do they have to do? They have to pack in more patients. It becomes volume driven. They have to do more surgeries. They have to do more MRIs because the system forces it. And the system never asks, hey, how's your patient doing? Are their aches and pains gone? Is their diabetes gone? Nope. It's all about how many procedures you do, complex with a simple visit. There's no conversation of how the patient is doing. And of course, the patient is suffering because he can't get any quality care. The medical provider is suffering because he can't give quality care and he has too many patients to see for one human to process. The only person who's happy in this scenario is the insurance company because the person who's paying the bill has been collecting a little bit every month from every customer. And the very first thing that they do before they pay the providers is pay themselves. So if you're going to be mad at anyone, it's not your docs or your NPs or your PAs. It's the CEO of Toaster Funds. Now, I just want to let you know that this affects everyone. This affects me as well. I still practice in primary care, and it's hard, not because of the patients. I love my patients. The system is draining. I need to see a lot of patients in the day and to try to do the very best I can for them in a short amount of time. And then when I order the labs or the medications, insurance then sends someone who's not qualified to let me know, nope, you can't send this medication. Nope, you can't order this lab. And then, it's just a fun game. So the bottom line is this system is designed to keep you coming in. It's not designed to get you better because no payment is given for improving quality. It's just codes and codes and codes. And it's not the medical provider's fault. I really need you to know that. You are getting shortchanged as a patient because the system is effed up. Now, do people get better sometimes? Of course. There are some great toasters out there, and there's some great medications that really fix things. And if you're one of the people who have a simple A to B issue, yeah, you'll get better. You need blood pressure pills? Yeah. You need something removed? Awesome. You have cancer? Here's chemo. Kidney failure? Here's dialysis. Of course. If it's a simple A to B solution, yeah, it's going to work out for you. And some of us toaster makers really have learned the system well enough to try to give the best possible care within these constraints. But if you have something that requires out of the box thinking, or if you're looking for someone to spend time with you to discuss how to prevent getting sick or how to manage your illness in a different way, you cannot get it from the system because it's not designed for it. Now, I can go on and on with insurance, but I think you get the picture. Let's talk about the next public enemy, which is I'm waiting for someone to show up at my house and shoot me. The next one is drug companies. Next on my list, drug companies. Okay. So, drug companies. The thing about drug companies is that they're a critical part of our health. We need them, but they're also part of our sickness. And it's very important that these companies exist. We do not want to dismantle them. They provide a lot of good technology and a lot of good things that we need. They do research and development, and they help us find medications that save lives. It's really important that we recognize that. People would die without insulin or seizure medications or chemo or 1,000 other, life-saving medications. So it's important that they continue doing that work. It's so important that the government funds part of the research and development by giving these companies tax credits. The government basically says, since you're spending your time researching how to save lives of our people, here's a tax break to encourage, this investment in research. And so the tax credit is created there so that companies continue to do research and development. And it's really, really important. And it's awesome. And we're glad to have them. However, on the flip side, these drug companies will only stay in business if there is sickness to cure. Okay. In 2012, I was not able to get more recent data, but I'm sure it's worse. $146 billion was spent on prescription drugs and the top 5 classes, which are preventable diseases. Listen to what I'm saying. The drug companies are making the most money on preventable conditions, diabetes, GI issues, certain cardiovascular issues. So if we become healthier as a nation, we won't require these drugs for our preventable conditions. How will drug companies make money? Tell me why any drug company would want us to get better. The way they survive is for us to stay sick. In 2020, this one's going to be really annoying for you, so I'm sorry if you're triggered. But in 2020, cancer treatment cost $208 billion. And we know, for example, that many cancers are associated with being overweight or obese. Several of these cancers are also associated with not being physically active. But is anyone paying for personal trainers or outpatient nutritionists to actually prevent the disease that we know causes cancer? Nope, we're not doing that. So we're believing that we're spending all this money to cure cancer. And so we open our hearts, we open our purses, we open everything because we're thinking, we're part of this thing to cure cancer. But what we're actually perpetuating is a reliance on drugs. Instead of considering putting billions of dollars into providing healthy practices, healthy foods, health education, we're spending more and more money towards aggressively treating a disease, and some of it is preventable. So we raise money to endlessly search for a cure once the patient is already sick, but we're not spending any money to prevent them from getting sick. Okay, that's all I have to say about drug companies right now. I'm moving on to specialists. And I have many friends who are specialists, so this is not a personal conversation. This is, a little bit more global. So hear me out. This one seems weird because in America, we have the more specialists than primary care. They outnumber primary care by 3 to 1. Now, why would this create a problem? Isn't it a good thing that we have so many specialists? Not really, because we have so many specialists and we don't have enough primary care. Who cares? What's the problem? America spends 50% less on primary care than any developed country. Any other developed countries recognizes that having primary care not only saves the system money, but actually achieves better results. Consider this. Consider like if somebody has a back pain and that person says, okay, there's no PCP around, I'm going to go to a back specialist, somebody who specializes in like really intense back things. I have this back pain now for a few weeks. I'm going to go. He goes sees a back pain specialist. Back pain specialist has a few things to check off, make sure it's nothing, serious. It's not an infection. It's not a tumor. But, he arrives at diagnosis. Maybe he sends him for some imaging, gives him some pain medication, and sends him on his way. Now, consider a different scenario where that same patient goes to a PCP, primary care, that knows him, that spends time with him, and that PCP explores why is your back hurting by taking the time to ask open-ended questions, actively listening, and finding out that this person's not sleeping, is under stress, maybe sits a lot, has not been exercising, all contributors to back pain. In this scenario, the patient receives education, maybe some physical, a recommendation for PT, and helps, maybe some self-management stress. Some tools to manage stress. I'm not really sure why I'm stumbling over my words on this one. Maybe I'm stressed, so it's triggering me. So in the first scenario, the insurer pays for this transaction. The patient didn't really get a solution because they just got an image and maybe some medication. In the second scenario with a PCP that can explore what's going on, the patient actually has the potential of getting better. But that's not what happens because we have so many specialists. Now, this is not because specialists are bad guys. It's the opposite. You have to remember that specialists spend 10 to 15 years of training focused on one body part, right? So if they're a back specialist, they're only focused on one body part. Kidney specialists, just they only focus on kidneys. They're not focused, and they're focused on getting the sickest of the sickest people and to find a disease and to cure it. They're trained to be myopic. They're trained to look at one thing because they're experts in their disease. They are not trained to step back and view the human as a whole in an integrated big picture of health and practices. They're not trained to look at the whole body. So while specialists are great when you have a particular issue that requires a very specific level of detail, you don't need to start there. You want to start with PCP. And ideally, you would have a system that supports primary care and lets the primary care spend time to ask questions and see what the patient really needs. Every other developed country knows this. And that's why they have more primary care than specialists. But here we have it upside down. So primary care it's the heart of, the way primary care works is that you can establish a unique relationship between provider and patient. Like I know my patients. We have this long-lasting relationship over years where I can know what's happening in their life. However, there's no coding for conversation. There's no code for spend time with your patient and give them some preventative, information. It doesn't support the complex work of a primary care team. The system supports, oh, I need an appendectomy. Let's remove the appendix. The system supports, I need to have something removed. Here's a code for removal. There is no code for the complexity involved in figuring out what's going on with a patient, maybe talking to their family, maybe calling the school if necessary. There's no code for that, so it is not supported. Specialists have sophisticated tools and treatments and procedures, and primary care has conversations. And conversations is not supported by the system. So as a result of this thinking, just see your patient and send us a bill for the codes, what I talked about earlier, you have a system that encourages procedures. But the problem is that the work of prevention does not have procedures. It doesn't really have a code. It's really not quantifiable. To really prevent an issue, you need to spend time with your patients, get to know what barriers to healthcare they have, come up with plans, revisit the issues again several times, maybe discuss with their family stress relief options. At times, you'll talk to the patient's partners, the parents, the children to get to what's going on at home. It has to be customized, and there's no CPT codes available that will ever compensate a provider for the time it really takes to delve deep into what's going on with the patient. And the crazy thing is, if we did pay for this kind of prevention, it would save us money because we wouldn't need so many procedures once our patients get sick. So for a system to work well, you would need to have so many primary care providers who can spend so much time with their patients. Keep in mind, the PCPs are the first people to contact when you have a health problem. So they're ideal leaders of the system if we want to improve care for patients. If we understood that good primary care can not only be good for patients, but could save us billions, we would ensure to establish a system where the PCP can sit and listen to his or her patient. But instead, what we have is a system that pays its primary care providers much less than specialists. PCPs are stressed, burnt out, overworked, underpaid, under time pressure to check patients in less than 10 minutes. And guess what happens? The med students that are coming up now, that are graduating, they're not going into primary care because who would go into primary care, right? It's crazy. Okay, so I had another topic in mind, but it's already 26 minutes in, so I'm going to skip this topic and go over to how, if this system is so messed up, how do I get out? Okay. This is a really triggering talk. And so I want to make sure I give you something hopeful to come out with this episode. Because the next question is always going to be, well, what do I do? If it's so broken, how can I stay healthy? So the answer is use the system for what it's designed to do and opt out of the rest. What do I mean by that? First and foremost, it's designed for sick people. If you're sick and you have a diagnosis, the system will work for you. If you need the latest and the best medical, pharmaceutical intervention, you're in the right place. Use every bit that you need. If you're not sick and completely well, use the system for screenings. Get your annuals, get your pap smears, get your colonoscopies, get a head start if something isn't right. If you're not sick, but not really well, this is the hardest place for you. So you're not feeling well and you keep going from one doctor to the other and they keep telling you nothing is wrong with you. Don't get mad. Be glad that you haven't been labeled as sick and find someone like me in functional medicine that can help you get to the root cause. Use the system for its strong points, the labs, the images, and don't get frustrated when it can't give you someone who can listen or get to the root cause because it's not designed that way. Just let it go. And here is the most important part of it. You need to opt out of the system when you can. And opting out means trying not to get sick. Opt out of the standard American diet. Opt out of the sedentary lifestyle. Don't smoke. Don't drink too much. Move whenever you can. Use your nutrition as your medicine. Make decisions every day that will keep you out of needing the broken system. And of course, this is a lot. And if you ever want to work with us, this is how you reach us at The New Method on every platform. The New Method, new is spelled with a K because you always knew there was a better way. And I look forward to hearing from you. On every platform, there's a way to reach us to make a consult. And I hope you become the game changer in your life because you always knew there was a better way. I'll talk to you guys next week.